Ladies and gentlemen, thank you very much for joining. No matter where you are in this big wide world, we're delighted that you could spend a little bit of time out of your very busy days to talk with us or to listen to what we have to say or to find out a little bit about our views when it comes to healthcare and how it relates to business process outsourcing. Now, for those of you who don't know me, my name is Peter Ryan, and I am the Chief Analyst and founder of Ryan Strategic Advisory. I'm based in Montreal, Canada, and I'm absolutely delighted to be here with what I think is very much a star-studded panel that's got a lot of experience when it comes to the delivery of healthcare services from a BPO perspective. And we're going to have what I consider to be a very stimulating and a very intuitive discussion around what some of the key trends are. I don't think there's any question that right now the healthcare space has taken on a life of its own, not just in terms of what's going on with the ongoing pandemic, but certainly from the perspective of how perhaps business services associated with healthcare can be delivered in an efficient fashion, in a compassionate fashion, and in a manner in which the patients are going to be treated in the best possible and expeditious way with third-party partners. Now, what I'd like to do before we get into our chat today is have a bit of a discussion around what some of the key trends are at Ryan Strategic Advisory that we've been picking up on in our own research. And I have to say, I wouldn't be a market analyst if I didn't have at least a few graphs or a few charts to show you. And I will certainly be doing so over the course of the next couple of minutes. So if you bear with me, ladies and gentlemen, I'm going to share my screen and pull up a very brief presentation that I think is going to highlight some of the key elements that healthcare organizations have been facing in regards to their own front office BPO or contact center operations. So hopefully technology will cooperate, and it looks like that it is. So as I enable the presentation mode, obviously one of the things that I think that we're hearing a lot about in terms of our own research is the element about the extent to which healthcare organizations are looking to try and engage with outsourced operators to provide them with a level of support and a level of efficiency that perhaps they might not be able to maintain or be able to drive within their own organizations, given the tremendous pressures that these types of organizations have been facing over the course of the past several months and are likely to face in the ongoing quarter or two. So one of the first things I want to talk about is a survey that we undertook at Ryan Strategic Advisory, the Front Office BPO Omnibus Survey, where we surveyed nearly 600 organizations, nearly 600 contact center organizations from a captive perspective. What I've done here is I've broken out the healthcare respondents, and what we can see here is that when it comes to what the pain points or the challenges that they're dealing with within the scope of their own organizations, we can see that there's a number that they certainly are having to cope with or deal with on a regular basis. These include ensuring strong levels of site security, making sure that new digital channels, new non-voice channels are integrated into the healthcare CX delivery perspective. Definitely a challenge from the standpoint of what's going on with the plethora of new channels that are popping up all the time. Being able to try and draw in advanced technologies like artificial intelligence into healthcare BPO delivery, and certainly finding the right agents. Very, very important when you're dealing with people who could be facing some very sensitive situations. Now, pain points are one thing, but the ability to alleviate pain points are another, and we can certainly see this from the perspective of budgets. One of the questions we asked in the Front Office BPO Omnibus Survey was the extent to which healthcare organizations were anticipating that their own contact center investment capacity was likely to evolve over the course of the coming calendar year, going into 2021. Now, this I find very frightening. If I was a healthcare contact center operator working on a captive basis or an in-house basis, I'd be very, very concerned in the sense that of the respondents to our survey, it was roughly 70% that indicated that their budgets were going to remain flat or actually decrease in 2021. And only 3 out of 10 indicated that there was going to be some growth. Now imagine that you fall into the category, if you're a healthcare operator falling into the category where you're saying that your budgets are going to stay flat or they're going to go down. That means you will not have the capacity to invest in people, finding the right agents, recruiting the right people, training them up and making sure that they can do the best jobs possible, investing in technologies, automation, artificial intelligence, analytics, and in terms of the processes, making sure that you're as compliant as possible. Certainly some big challenges. And this is why we're picking up at Ryan Strategic Advisory. So many healthcare operators are looking at moving into the domain of at least sharing some of their contact center functions with a third party. And when we're thinking about what healthcare operators are looking for when they're going to work with a third party, our survey shows that there's a number of very important advantages that an outsourcer needs to bring to the table from a healthcare perspective. Being able to manage information security is going to be crucial in terms of that process element. Certainly providing not just the frontline services, but the value-add consultative customer experience capabilities. Healthcare operators in the contact center domain are desperately looking for this, as are home-based agent capabilities, the capacity to actually go out and provide services, not just from a central contact center operation, but from agents that are virtualized, perhaps around a city, around a state, or even around an entire country. Certainly, I think managing compliance is going to be a very big element, and green contact center delivery is becoming a much bigger element too. So a few things to consider as we go into our discussion today. The fact that there's a lot of challenges going on around contact center delivery when it comes to healthcare operations, around different channels, around finding agents, training the agents and retaining those very, very valuable members of the staff, and security in regards to how information is going to be locked down. Managing these pain points, managing these challenges, it's going to be very, very difficult, especially for the majority of healthcare contact center operators who are facing decreasing budgets or flat budgets. And more than ever, we can see that there is a need for third-party operators to join with healthcare contact center operations in order to help them out with compliance and information security management in terms of providing alternative business models such as home-based agents and moving that customer experience element to the next level. So as we consider what some of these key takeaways are, I am not going to try and talk about all of them on my own. Fortunately, I've got a great team on the form of a panel that are joining me from KM² today. And what I'll do is I'll ask them both to introduce themselves, starting with Geneil.
Thank you so much, and good morning, everyone. Thank you for joining. Thank you for the invite, Peter. Let me start with a brief description. Well, I've been part of KM² now for the last 9 years. I'm currently the operational director for our healthcare division in Honduras. Based from our location in Honduras in the city of San Pedro Sula. I do have a background in medicine and also into engineering, and I've worked in the implementation of pretty much all of the healthcare accounts that we have in KM², not just in Honduras, but also across our sister locations in other countries of Latin America and Grenada.
Great stuff. Thanks so much, Geneil. And I will say too, you probably got one of the best views out your window of anybody I've ever seen in a webinar.
You guys are welcome to come here.
That's great. Thank you so much. Mark, over to you.
Thanks, Peter. I won't show you my view. It's just someone else's house. But thank you. So my name is Mark Mele, and I am the Vice President of Client Services here at KM². And I manage a couple of our major account relationships in our healthcare practice, as well as some others. I've been with KM² only about 5 years, so Geneil's been here a lot longer than I have. And then I've been in the general BPO industry for a little over 10 years, and then the overall professional services industry for, I hate to say it, but 25 years. So, you know, with KM², I focus primarily on client services, and historically, I was actually a back office technology guy. So thanks, Peter.
No, thank you. And, you know, I think this is a good place to kick off our discussion today with Geneil and Mark. We have got two individuals that have got tremendous experience in healthcare as well as the provision of third-party services. Now, Mark, I'm going to kick off with you in terms of my first question. One of the things that I've always associated when I've looked at third-party service delivery, especially from a contact center perspective, we have traditionally what we would call the more mature industries or the more mature verticals that have been using this business model for a long time and very successfully too. But I've picked up in my own research the past few years, there's been a real interest in healthcare and the provision of healthcare services from a contact center third-party angle. So I'd be very curious if you could talk a little bit about KM² and its journey within the healthcare space. What got KM² into the healthcare element, and how has that been going for the company?
Okay, sure. So when KM² is about 16, 17 years old at this point. So when we were about 10 years old, give or take, we had a very rich heritage of financial services work. Some of our founding principals, as well as some of our employees, had a background in, large banks, credit cards, auto lenders, that sort of thing. And we also had a deep concentration of skills in accounts receivable management and loan servicing. And so, when the company was about 10 years old, they did something that we still continue to do periodically, which is, some of the executives got together and discussed, what do we want to be when we grow up? Where are we now? What assets do we have, and what more could we be doing? So the outcrop of that initiative was figuring out, okay, we operate in a highly regulated, very controlled industry, financial services. So what else could we be doing since we have all these processes and controls and know-how? What's a similar industry? And then also identifying we didn't want to be a single vertical company. So, I think one of our employees at the time had some healthcare experience, and they said, geez, we've really got the DNA to go after healthcare. And I think there was some pushback saying, healthcare is highly specialized. We don't have a lot of talent or experience as a company by way of healthcare. So what was decided was, well, let's go out there and try to find, a revenue cycle management organization who might be looking for something that we're very well equipped to provide. So as I said, we were into loan servicing and, accounts receivable management. So, healthcare providers have to collect bills. They have to deal with insurance companies. So what we did was we leveraged kind of a combination of personal relationships and desire with our core competency in loan servicing, and went out there and found a healthcare company who either didn't want to be in the revenue cycle management game or specifically with the account management, or just wanted to lower their cost. And so, the anecdote we got a lot was they didn't do proactive. A lot of the companies we spoke to and still speak to, they don't do proactive kind of collections or management of their receivables. They send out a bill, they send out an insurance claim. What gets paid, gets paid. If it doesn't get paid, in 30, 60, 90 days, they'll send out another bill. And when it doesn't get paid, they might write it off. They might refer it to a third-party debt collector. So those were really the guys we wanted to go after. Those guys, as well as folks who just would rather focus their internal employees on clinical operations. And so we said, we can do this for you. This is our core competency, and we can probably do it cheaper because we're using nearshore labor. So, once we had our first customer, it was probably less than a year before they said, gee, you guys are doing a great job. What else could you do for us within our company? So then we moved from accounts receivable management into appointment setting, appointment changes. We even got into proactive pitching of different types of medical exams and trying to secure appointments, kind of cross-marketing to other family members or referrals, that sort of thing. Then we got into retention, insurance verification. So once we had that one customer, it was easier to go wide. Then also once we had the one customer, it was easier to get customer number 2 and customer number 3 and customer number 4. And then it was also easy to go from different industries. So, we started in dental, then we branched off into dermatology, radiology. And so now, we've got around 1,000 people servicing healthcare, all because, we dipped our toe in the water in that first client with accounts receivable management.
Okay, great. Thank you very much, Mark. That's a really good synopsis in terms of KM² and its journey through the healthcare element when it comes to BPO provision. Really appreciate it. Geneil, I'm going to throw the baton over to you now. I think we can all say, no matter what angle of healthcare, it's an industry where there's never a dull moment. There's all sorts of elements that have been going on in healthcare prior to the past 6 months. But I want to try and focus on what's been going on in 2020 specifically. From your perspective, in terms of the KM² healthcare clients that you've been speaking with and that you've been dealing with on a regular basis, what are the major challenges that they've faced this year? And what's KM² been doing to help them overcome these obstacles?
Great question, Peter. Great question. So I think that we've got, 2020 has been a changing year for everyone, right? And with that, healthcare organizations did not stay behind. One of the key items that we had to go through during the 2020 was really the restructuring or re-engineering of processes. Going into a doctor's office today is not the same thing as going into a doctor's office back in 2019. And I'm not just talking about, kind of the temperature checks, the face mask, all of these things that are around COVID-19. I'm talking about business strategies as well. And when I mention that, I'm referring mostly around the fact that today, for example, because of the same social distancing that we need to keep, different healthcare organizations have kind of had to go through a situation where they've had to adjust their overall scheduling templating. So we are scheduling less patients into the office because we don't want waiting rooms that are cramped up with patients, right? We want to ensure we are taking care of the patients, right? We're ensure that of the safety and ensure that we're not, there's no, we're adhering with social distancing in general, right? So we're seeing that there is a reduction in the templating. So with that, business strategy has to be oriented towards ensuring that those slots that are available are being filled. And again, because of the whole uncertainty, we are seeing more cancellations and reschedules that are coming in from different patients. So my advice and one of the items that I've seen as a key item right now during 2020 is healthcare organizations need to have a clear strategy as to how they're going to address their different openings that they have on schedules and templating. Not all organizations do that, I'll be honest with you. And I think that that's an item where opportunity in order to increase the overall capacity of what they do have available at this time. That's a key item. Some items that can go into those strategies are working outbound accounts where you're calling, you're confirming accounts, you're calling patients that have canceled calls, canceled appointments, you're calling in to do reschedules. Not everybody sees the value in it, but I can tell you that organizations that do that, right, it does take them a step ahead. And what do we do to kind of help our clients, right? We do make suggestions such as these. We have been, and Mark mentioned, right, that we have different types of companies. We've got dermatology, dental, radiology, several employees, right? So the idea between it is the fact that we already have strategies in place that have worked in the past, right? And we have that business knowledge that we can share with the clients to help them get ahead of this with these types of situations, right? We have the technology around it to help our clients together because we do partner with them in order to build outbound campaigns successfully to get them ahead through these types of situations. Telemedicine, okay? Let me bring telemedicine up. Telemedicine is not something new from 2020, right? But what's the situation? Patients are more comfortable walking into an office to see a doctor than having an appointment online. So we needed to train resources adequately so they could clearly explain the benefits of this, especially during these times where some offices were closed. Maybe you had a situation where you saw your doctor, you needed a follow-up, and he can't wait for the office to be open, or maybe we're completely booked, right? Because again, we have less slots available at this moment. So with these situations, telemedicine becomes an option. So at the beginning, we saw a little bit more of a resistance from some of the patients. I'm seeing that that's not the case now. But the ensuring that the representatives, the schedulers, right, are able to educate patients about what is telemedicine. And healthcare organizations need to get ahead and also have on their end the ability to support, because you're going to have patients that can't log in, right? That can't log in. Some people are not, using different types of joining meetings is not easy for them, right? They may be elderly patients, not always do they have somebody there to assist them. So sometimes they need additional help and support. So in those cases, it's very important that we also think about that portion of the business to ensure we're servicing our patients. Because again, they are your patients, right? And as your patients, they want to be able to get a hold of you. If they're having difficulties getting to you, guess what? They're going to start looking for the next healthcare provider that is there for them. And Mark, I don't know if you want to share a little bit, because we did have something about rebalancing of headcounts.
Sure.
Demands like spiked with some clients, and they completely like went almost diminished with others. I don't know if you want to share about that.
Sure. Yeah, and I think that was particularly challenging for a lot of our customers where, in around the March timeframe when things started to get bad in the US, demand at one point pretty much evaporated. And understand, we have clients that span pretty much the entire United States. So in the beginning, it seemed like pretty much all of our clients went hard down for at least a couple of days, if not more. And, at the same time, they're making decisions about their business and, employees and furloughs and office closings and that sort of thing. So they had to make decisions on, even when in terms of us, if they had no business, they didn't need us around. So thankfully, because we're in multiple countries and we had a lot of headcount. So as some of our customers would go down, we would contract our staff to kind of help them out with their demand curve. But then what started happening pretty quickly is some states reacted differently than other states. So some states reopened, some states didn't. Some clients more quickly adopted telemedicine, some didn't. So in the background, we were able to support them by shifting resources. If we had one customer who wanted to go down, but one was coming up, we said, geez, we've got experienced healthcare professionals, we can move them over here. And sometimes that move might have only been for a couple of weeks, because some clients opened and then they closed again, opened and then closed again, or they opened, started rebooking, then found out there were social distancing guidelines and then had to call and start canceling again. And one thing I just want to touch on that Geneil mentioned was that the experience of a doctor's office has changed. And I think where the focus of a lot of the practices, and especially the ones who really are winning, is really using their centers or us, as well as other forms of media, to really educate the customers on what to expect, especially since they've had to reduce density and capacity, see fewer patients every day. Seeing each patient really matters. So they don't want a patient to arrive who might be coughing or arrive 45 minutes early when only 5 people are allowed in the office. And so it's our job, or their center's job, to really set those expectations to say, your slot is 9 a.m. When you arrive, have this ready. Please don't arrive early. Please don't expect to hang around. Don't bring other family members or your kids with you. We really need this to be logistically kind of perfect so we can keep moving people through. And so that's really been our goal, is to take what demand is there and maximize it.
Thanks very much to you both. Those are, I think, some really great insights. Mark, I'm going to stick with you for just 1 second.
Okay.
Geneil talked about it's important for an organization to have a clear strategy when it comes to healthcare, and that encompasses a whole series of different elements within the provision of front office work. One of the most important things I've been picking up on the past few years, especially, and we saw it in some of the results from my survey data, is the need to be compliant with all the different regulation when it comes to information security. You know, when we're talking about information security in healthcare, we're talking about people's insurance details, we're talking about social security numbers. There's a whole host of different elements that need to be protected, notwithstanding in individuals' medical records. Could you talk a little bit about, from your own experience, what the important elements are for an outsourcer to come to the table with when it comes to compliance around HIPAA or any other elements around information security?
So Peter, it's interesting. You know, I mentioned prior that we had a long heritage in financial services. So, you know, similar to healthcare, financial services, they guard their customer data like Fort Knox. And so we have a very mature program here at KM² between information security and compliance, where we've actually got two senior level executives of the company, a compliance officer and an information security officer, dedicated positions who their full-time job is just safeguarding our physical sites, our data and our customers' data. And at a high level, there's kind of a three-prong approach to it. There's a logical or systems approach. There's a physical approach for what happens within one of our facilities. And then kind of the glue in between those is a robust series of methods and procedures that ensures we're adhering to safeguarding PCI or personal health information and anything else. And so firstly, with logical, it's kind of the basics you would expect. Every system we have is bolted down. We mask data when we can. We don't store data within our facilities or within our data centers. Our facilities, we really just have a remote window into our customer systems. So anytime we click save or commit a record, it's not happening in our facility. It's happening back at the customer's site. So if they're comfortable with their security, we're not affecting that at all. And then similarly, we don't give our agents access to the internet. If it's required for a customer program, we employ firewalls with whitelisting, which literally means we have to lay out each individual site an agent might need to get to, and we only enable those sites. So they can't go to YouTube, they can't go to social media, they couldn't get to a personal email. And similarly, unless it's a requirement, they wouldn't have email or access to collaboration tools. And if they do have access to email, that too is restricted to the domains that they can actually email to. So they couldn't take data, put it in an email and send it out. And then lastly, we severely limit their ability within their desktop to copy and paste. So even if they did have email, they couldn't copy and paste a customer record as an example and email it out. So then comes physical security. Within our sites, everyone has to wear a photo badge, from the president of the company down to a custodian. Those badges have RFID enabled chips in them, and every doorway you have to walk through within one of our centers to a new suite or a training room or an HR area has an RFID reader on it. If you don't have a business reason to be in that suite, your ID doesn't work. I couldn't go visit a friend of mine who works on a different program in a different suite because my ID wouldn't allow it. And then within our suites as well, there's no paper. We have a clean desk policy. There's no printers. There's no cell phones allowed, no recording devices. Pens aren't allowed, pens and paper. So there's nothing anyone can do to record any sort of customer data within one of our centers. And then lastly is really just the methods and procedures. So every employee in the company goes through a battery of, I think we're up to 21 modules, training modules, and then they have to recertify those every single year, which discuss specifically safeguards around HIPAA and PCI, as well as a variety of other security and compliance protocols, such as like UDAP and do not call list and stuff like that. And they have to recertify every year. And probably specifically for HIPAA and healthcare, probably one of the most important things we teach them is just, you're going to have to talk to customers and you're going to have to talk about sensitive information. And so the first line of defense that we drive into them and is really just making sure you verify fundamentally who you're talking to, and then you're verifying within the customer record that that person is authorized to have information disclosed to them. We call it right party authentication, or we've got a couple of different customers call it different things, but just ensure who you're talking to is authorized to receive the information you're looking at. And then lastly, before we make any changes, we get a new contract, we roll out a new training program, we do a major policy change. Our two custodians that we kind of spoke of, our head of InfoSec and compliance, they have to review everything and approve, because the compliance world is big. We operate in 50 states. Sometimes there are state laws or state regulations that kind of dovetail with federal. Sometimes they dovetail nicely. Sometimes they're more strict. Sometimes they're less. So sometimes we get asked to do something where our compliance folks might review it and say, gee, that doesn't seem right to me. And so that just gives us an opportunity to bring it to the client's attention, get on the phone with their compliance folks or their InfoSec and say, hey, you guys are making a policy change asking us to do this. We have a concern that that might brush up against a policy. How do you guys see it? And we'll kind of collaborate together to see, are we not looking at the regulations correctly? Has there been a law change that we weren't up to speed with? Or are they potentially making a misstep that we can help them avoid because they haven't been looking at some of the same regulations we do?
Thanks, Mark.
So sorry, Peter, that's my long-winded answer.
No, it's great. Very comprehensive. Thanks. And Geneil, did you have any thoughts that you'd like to add to that?
Yeah, I do actually. So in the initial presentation, you had as the number one item, and I wrote it down, integration of new digital channels, right? As one of the pain points for the healthcare organizations. I can tell you that this is a big item, right? Because there are platforms out there that healthcare organizations can go and search for that will allow them to interact with patients via messages, text, email, interact with pharmacies, interact with labs, all together into one solution. This improves the communication between patient, healthcare provider, pharmacies, labs, whatever that be that you're integrated within this platform. And by doing that, we're going back into the situation where we're ensuring that patient experience, right? I'm there for you because I am your healthcare provider. And I just wanted to add that in there, Peter.
Well, no, thank you very much. I think it's a really good addition to our discussion. I'm going to circle to our last question before we get into our Q&A portion of the discussion. And by the way, ladies and gentlemen, we've had some great mind share so far. If you have any questions, please use the chat function that you'll see at the bottom of your screen, or you can use the Q&A function to send in any queries you might have for our all-star panel of Geneil and Mark. But before we get to that, before we collect some of the audience participation questions, I want to ask you both perhaps something to round our discussion up today. I'm a first-time prospective outsourcing client looking at from the healthcare angle. So I'm a healthcare operator. I've not outsourced before to a contact center provider. What are some of the key elements that I should be thinking about? Mark, starting with you, what are perhaps the three elements that they should be thinking about?
Three elements. So I think what they really need to make sure of is that they have documented methods and procedures that are going to be easily, or not necessarily easily, but that can be ported to another organization. And we can talk a little bit more about that, but let me kind of get the key points out there. The other thing is understand that, partnership is a collaboration, and typically when you engage an outsourcer, you're not just saying, okay, I'd like to outsource these seats to you, here you go. There's going to be an integration effort on by both parties, and there's going to have to be some level of engagement long term to ensure maximum success. And then lastly, you need to make sure that you have a plan and a roadmap for integrating your technologies and ensuring that that they can be integrated and that you have a strategy for that, and that kind of like my first point, you have a comprehensive way to train and ensure that the outsourcer is well equipped to capitalize on that technology. So let's dive into those a little bit. I mean, Geneil, you've done a lot of these implementations. Do you want to talk a little bit about the value of kind of making sure everything is documented and that you have your MMPs bolted down?
Sure, sure. And you know what? Not always do when we go out the first time and meet clients, not always do they have everything documented, and that's okay, right? We do have the experience. Look for a provider when you're looking for an outsourcer for a BPO. Look for a provider that does have that experience, because they can help you write this. A lot of the times I visited sites, and a lot of the training is done side by side. There's somebody, a new hire hired, they're sitting next to a 10-year employee. They do that for a month, and that's the way they learn. But when you're doing something and you're going near shore, right, you need to have everything very well documented, right? And if you don't, then ensure that you're looking for a provider, right, that does have the experience in writing this, that knows that will be able to guide you through this process to ensure it is a success. And you mentioned collaboration, key item, right? Partnership is everything, right? In order for this to be successful, it's very important that we understand how you run your business, and at the same time, you understand us. And that way together we can collaborate, right? And we can add best practices into the business, and we can continue to add value to your organization.
Yeah, and let me just jump in on that collaborative part, Geneil. There are different flavors of an outsourcing relationship, and some clients want to be more involved, some want to be less. And sometimes the work will really dictate how involved the customer should be versus the vendor. The best practices I've seen are when the teams take a really collaborative approach and they see each other as extensions of their own. And it could be little things like, access to the daily happenings in a knowledge base. I've actually seen before when, I'll get a phone call where they say, geez, your team isn't doing this they're not executing the new process. And it's kind of like, geez, we were never told there was a new process. And I think teams that look at it like, oh, they're the outsourcer, they take care of that business. And that can be true, but we need to be involved. We need to know what's changing. We need to know when there's policy changes or whatever. So the more integrated the team can be, the more that they can have sort of a dedicated account management or dedicated operations management, single points of contact for various people in your organization, the better that relationship's going to be and the more productive. And then the last thing I'll say is when Geneil's talking about having things documented and whatnot, what our experience has been quite often is a client's organization may have grown by 2 people over the last 20 years, and now they're up to 250 people as an example. So they've never had to train or roll out capabilities at scale. So if they engage us and we have to bring 50 people up to speed, in a 2 or a 4 week period, like Geneil said, sitting individuals next to each other, which might have been a traditional way to train, isn't going to work. So that's where you want your provider to be able to look at your training material or actually sit there in that chair, take the training how they would normally do it historically, and then translate that into an actual instructor guide and training modules and learning management modules and tests and the whole 9 yards. And also look for a provider who's willing to kind of push back on what you do. We do this for a living. We do this every day through a multitude of industries and transaction types. Chances are a lot of our customers don't have a mature training organization. We do. So look for a provider who's going to give you feedback, who's going to say, you know what, this is good, but I would enhance it this way. I would put multimedia implications in it and that sort of thing, to just make sure that that provider really knows what they're doing, is going to ensure you a successful outcome.
Great. Well, thanks very much to you both for that insight and those great answers. What we're going to do now, ladies and gentlemen, is throw it open to our Q&A portion of the discussion. We've had a few questions already that have popped in. And Geneil, I'm going to start with you on the first one. We've had a viewer who's asking if you could speak a little bit to the bilingual capabilities that KM² can bring to its healthcare clients.
Sure, definitely. So I think that's one of the big items that differentiate us from other BPOs. We are a nearshore company, and with that, there is a strong affinity to the U.S., right? Locations where we are in Latin America, such as Honduras, Colombia, the Dominican Republic, have a very large population of bilingual speakers, right? And with that, when it comes to healthcare, healthcare is a little bit of a different item from the customer service perspective than if you're looking at other sources of service, right? Why? Because there's a lot of jargon that goes into it. There's a lot of different processes that are very specific and not necessarily are a given for people. It needs to get additional up training regarding these. We do have great bilingual capabilities that have enabled us to be able to gain the clients that we currently have in the locations due to some of these items, right, that I just mentioned a bit ago. Additionally to that, I want to reference something particular for our location here in Honduras. I have several physicians, actual graduate doctors in this building that are working here, servicing patients, scheduling phone calls. And that's something that it's very unique of this country, right? We do have a very large population of bilingual doctors, right? And with that, we have been able to source some of these, and we do have people in positions such as supervisors, managers, that not only have that experience from the customer service portion of it, but they also have experience from the medical field. And that's one of the items that has made this location in particular very strong from the healthcare perspective.
Great, thank you very much. Mark, I've got one I'm going to throw to you, and this is a very interesting one. We've got a viewer who is asking, how has interactions with healthcare clients changed over the course of the COVID-19 period?
So for us as a company, and me being in a customer-facing organization, it's changed a lot. The last time I saw a customer was March 12th. Which usually, I'm in a customer's office every week or every month, and then typically I'm with customers down in Geneil's office, making sure the operating floor is going well. So everything has gone virtual. We have some agents working from home. Our offices are open, and we do have we are running at reduced capacity in our offices, but they are open, but we're not entertaining visitors at this point, like most companies. So it's gone from a very face-to-face experience to a lot of Zoom calls type meetings like this. And for our mature clients, thankfully, we have years of that face-to-face time. So it's just kind of a quiet period of not seeing each other face-to-face and not traveling. But we have actually launched 3 or 4 clients during COVID where they haven't been to our facilities. I haven't met them, some of them. I haven't met some of the operating folks who are supporting them, nor has the client met them. So it's definitely a different time, but we had already done a lot of our work. We used a lot of collaboration tools and webinars and stuff like that. So it was an adjustment for us, but it wasn't like a brand new world. So things are different, but we're definitely making it work, and I think our clients are still feeling close to us and feeling cared for. But I do look forward to getting back to their offices and getting back down to Honduras and our other locations.
Absolutely, absolutely, Mark. Thank you. And I think that it speaks volumes in terms of KM²'s capabilities that you've been able to launch clients without having actually met them face to face or being perhaps in the same office or the same room. So congratulations and well done to the entire team on that. Ladies and gentlemen, we are at the end of our discussion today, and it's been a fantastic one. I think that healthcare has got to be one of the most interesting verticals when it comes to third-party service delivery. And we've been very fortunate today to have been able to leverage the insights and the experience of Geneil and Mark in this regard. We know that there's a few questions that have popped in. Unfortunately, we won't have time to get to them live today, but don't worry, we are taking note of what you're asking, and we will circle back with you in order to make sure that we're able to answer everything that you posed to us today. So again, thanks very much, Geneil, Mark. Thanks very much wherever you are in the world for having joined us. We truly appreciate your time, and we look forward to seeing you on the next KM² webinar. Take care, everyone.
Thank you so much. Have a good day.